Dr. Nardi here, back with another video. Today, we are going to dive into some of the most perplexing and intriguing psychological phenomena, the dissociative disorders. Normally speaking, we experience a unity of consciousness that provides a strong sense of self. We know our names, where we live, and we generally remember the salient events of our lives. But in people with dissociative disorders, one or more of these crucial functions of the self, identity, memory, or consciousness, become disturbed, sometimes bizarrely so. Dissociative disorders involve a disruption or dissociation, a splitting off, leading to a crack or break in the functions that typically make us whole. The major disorders in this category include dissociative identity disorder, dissociative amnesia, and depersonalization, derealization disorder. The most fascinating of these is dissociative identity disorder, known popularly as multiple personality disorder. DID is characterized by the emergence of two or more distinct personalities. Each of these alter personalities has its own distinctive traits, memories, mannerisms, and even style of speech. These personalities, or alters, repeatedly take full control of the individual's behavior. Some of the more common alter personalities may include children of various ages, adolescents of the opposite gender, or even professional roles like a nurse or therapist. The condition is often confused by laypeople with schizophrenia. However, schizophrenia, which means split mind, involves the splitting of cognition, affect, and behavior, whereas DID involves the splitting of the personality into two or more identities. A person with DID may also experience memory gaps concerning ordinary life events, important personal information, or traumatic experiences that occurred while other alters were in control. The host, or main personality, may be unaware of the existence of the other identities. Many cases of DID are strongly linked to a history of severe childhood sexual or physical abuse. Reported rates of such abuse among DID patients have ranged from 76 to 95% in some samples. In the case of quiet storm, a fractured personality resulting from severe childhood abuse splintered into many pieces. One alter personality, Nancy, would engage with the abusive father, shielding the others from having to perform the demanded acts. This type of dissociation offers a means of escape when no other means is available. The diathesis stress model of DID suggests that exposure to severe recurrent trauma, combined with predisposing factors like being prone to fantasize, being highly hypnotizable, and being open to altered states of consciousness, increases the risk of developing dissociative phenomena as a survival mechanism. While the diagnosis is officially recognized, it remains controversial. Since the 1970s, the number of reported cases has skyrocketed. Critics wonder if the disorder is being overdiagnosed in highly suggestible people. Some leading authorities, such as the late psychologist Nicholas Spanos, challenged the existence of DID as a distinct disorder, proposing instead that it is a form of role-playing. This social cognitive view suggests that individuals come to construe themselves as having multiple selves and begin to act in ways consistent with this conception, possibly learning the role by watching others in media or from unintentional cues from therapists. The role might be maintained through social reinforcement, such as attention from others. Regardless of whether it is a real phenomenon or role-playing, it is clear that people displaying this behavior have serious emotional and behavioral difficulties. The primary treatment for DID focuses on integrating the alter personalities into a cohesive personality structure. Therapists aim to help patients uncover and work through memories of early childhood trauma. The disclosure of abuse is considered essential. If successful, the person no longer needs to escape into alternate selves to avoid anxiety, allowing reintegration to become possible. Dissociative amnesia is believed to be the most common type of dissociative disorder. It involves an inability to recall important personal information, usually concerning traumatic or stressful experiences that cannot be explained by medical causes or ordinary forgetfulness. A rare subtype is dissociative fugue, characterized by sudden, unexpected travel away from home or work, confusion about identity, or the assumption of a new identity. People in a fugue state may appear normal in their new lives, but suddenly the awareness of their past identity returns and the memories of the new identity vanish. Depersonalization/derealization disorder occurs when individuals experience persistent or recurrent episodes of either depersonalization or derealization. Depersonalization means feeling detached from one's thoughts, feelings, or body. Derealization means a sense of unreality about one's surroundings. During these episodes, people might feel detached, as if they are dreaming or acting like robots. It is crucial to note that people with this disorder maintain contact with reality. They know who they are and can distinguish reality from unreality. The disorder is only diagnosed when these experiences are persistent or recurrent and cause significant distress or impairment. We also see dissociative features expressed in unique ways across different cultures. One example is Amok, a culture-bound syndrome found primarily in Southeast Asian and Pacific Island cultures, involving a trance-like state where a person suddenly becomes highly excited and violently attacks others or destroys objects. Afterward, they may claim no memory of the episode. Another example is Zar, a term used in North Africa and the Middle East to describe dissociative states believed to reflect spirit possession, during which individuals may engage in unusual behavior, such as shouting or banging their heads against a wall. Whether we view these disorders through the lens of psychodynamic theory, where massive repression shields the self from unacceptable impulses, or social cognitive theory, where dissociation is a learned response to distance oneself from disturbing memories, the dissociative disorders represent profound disruptions in the functions that integrate our self, memory, and consciousness. Thank you for joining me for this overview of dissociative disorders. See you next time.